9:27. Welcome back to CTV Morning Live, our Ask the Expert segment with Nick joining us from Ottawa Physiotherapy and Sports Clinics. If you have some questions to get in, 789-6559, extension 2803. Give us a call. You can always send us a message as well via our Facebook, Twitter, or email, ottawa.morning@ctv.ca. The topic already this morning has been on vertigo and dizziness and how it can actually be treated, knowing that that's the symptoms that we're dealing with and there's no other serious medical issue. And we're breaking down the different types, so the different types of things that you're looking for to be able to target what that person needs.
Yeah, so the most common one that we see, and this is where people always try to Google their symptoms, so the most common one is called BPPV, or positional vertigo. And what it is if you remember me talking about the three various canals, sometimes you can have these little crystals that everybody's got in their ear. They're supposed to be, lodged safely in a little pocket. But sometimes, whether it's a trauma or whether you roll specifically in bed one night, these little crystals can actually get dislodged and end up in one of these three canals inside one ear or the other. And that can definitely be a problem. So if we recall, we were talking about, it's a honey-like substance that moves nice and slow. Throw a big rock in there, all right? So now you have a rock that's basically tumbling over those little hairs. It definitely hyperstimulates your brain, and then everything goes, dizzy.
How bad can it get? I mean, sometimes you just feel off and you feel dizzy or you feel a little vertigo, but for some people you're saying this is affecting their daily lives, that they're actually not being able to function at all.
Completely debilitating. So we have people that basically stay in bed for weeks at a time because they're afraid of moving, all right? And this is where treating the dizziness becomes really important, because not only are you risking, falls, which then you're in the clinic for another issue, right? You break your arm or whatever. But it's also, you develop this fear of falling and then the complete loss of function and independence, which is not great at all.
And you've seen that with some of the clients coming in.
All the time, yeah. And we treat quite a bit at the clinic because not that many clinic, have a specialty person dealing with this issue, but it's really bad, not just for the client, but also for the surrounding family who's stuck at home trying to help this person. You have to take time off work and all these, all these other issues.
And it's hard to understand that a person feels like they're that everything is off balance, like getting off a roller. It's like being on a roller coaster the entire time. It can be very, very difficult.
And if you look in terms of symptoms, what those people that complain about, those key words that we really look for before we assess them are basically the inability to do specific things. So rolling over in bed, tying your shoes, there's specific movements that are going to bring on the symptoms. They're only going to last for about 30 seconds though, and this is one of those key things we look for, that 30-second sort of timeline, because let's say I'm affected, I roll over in bed, that rock is going to move, you're going to feel spinning. Spinning is also another key word we look for. But once that rock stops moving, you're back to baseline, all right? But you're still, you might have had some nausea, some vomiting. So those are other things that we basically look for in there. So what we try to do in the clinic in terms of, pinpointing, okay, you said all these things, is that what's going on? Sadly, we try to move the rocks to see if that's actually going on. So this is where a lot of times we might get somebody else in the room to help us. I basically lay you down on the bed and position your head, knowing the anatomy, into a specific position to try to recreate some of those symptoms. And then the symptoms don't lie for this particular pathology. What we're going to look for is called an nystagmus. So if you go to your doctor first, he'll probably do a similar test, but they might not treat it. But we look for an uncontrollable movement of the eye. So you're going to get this rotation basically going on the eyeballs. And this is where you won't feel that great. So, the nausea comes in and all that. And people sometimes panic. They grab onto the bed, they grab onto my shirt and choke me a little bit. But it's important to know that, those symptoms aren't going to last. They're only going to be there short term. For treating, here's the good news. The effectiveness is through the roof. So one treatment, studies have shown, is about 88% effective.
Wow.
And after 3 treatments, you're 98% effective. And if they're in that 2%, there might be something a little more intense going on.
That's huge. I mean, to see such a big difference being done even with one session. We do have to take a break. We will continue with more. And if you have some questions to get in for Nick, please do so. And you can always check out their website as well at Ottawa Physiotherapy and Sports Clinic, optsc.com. Send us in your questions. You can call, you can email, you can tweet us. We'll take any comments or questions. That's coming your way after the commercial break.